Over the past few weeks, the data and conversations have flipped, and more people are now Googling questions about tests rather than vaccines. Christina Laurie asked local doctors which questions they're getting the most right now.
With 1 in 4 COVID tests now coming back positive here in Wisconsin, many people are turning to Google for answers to questions like, how accurate are those tests?
So let's say I have a sore throat, a runny nose, and I'm wondering if I have COVID.
We got a local doctor on the line.
If I take a PCR or an antigen test and it's positive and I have symptoms, the test is awesome. Like, you have COVID. Like, there's very little doubt that you have COVID in that situation.
UW Health Dr. Jeff-Pothof says false positives are really rare.
But it's possible that that antigen test may be reacting with something else that gives you a false positive.
False negatives are much more common, which leads to a second question. Which test should you take?
PCR tests, a lot of people will test positive for 3 months after their infection.
PCR tests, the kind you get at testing sites, are most accurate and can pick up on COVID before at-home rapid tests do. But they can also detect the virus in you long after you're contagious. That's why doctors urge you to stay home for at least 10 days and as long as your symptoms last.
The thing that gets people in trouble with COVID-19 is the feeling that they can't breathe.
Finally, if you test positive, should you call your doctor?
When I'm in the emergency department and I diagnose people with COVID-19 who are not so sick as to need admission right now, I actually tell them to go get a pulse ox.
A little device you can get on Amazon that fits on your finger and tracks how well you can breathe. If the number drops below 88, contact your doctor.
That's what's so scary about COVID-19 is at the individual level, you really have no idea what's going to happen to you when they get the disease.
In Madison, Christina Laurie, News 3 Now.
And you can find answers to more common testing questions on our website, channel3000.com.